Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As everybody knows now that Dr. Deshpande is myself is MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, you can definitely WhatsApp on 922681060. My dear friend, this is the series regarding the complaints of the patient and what the general practitioner, the doctor should think in his mind about that particular problem. So today I have the case of one patient. Patient comes to the doctor that doctor, see, I am having the pain in my chest, and he is looking very anxious, and he is holding his hand on the left side of the chest, and he said that I am having the chest pain on and off, and doctor, I am very much worried about my chest pain. Then doctor should start, general practitioners should start thinking what can be this particular cause of that complaint. So her doctor in his mind thinks, yeah, I am also worried. Of course, not in front of the patient, not by verbally, but inside his mind, that immediately, whenever chest pain is there, the doctor always has to think whether that chest pain is a cardiac or the non-cardiac. Chest pain is related with the heart or is not related with the heart. Okay. And then doctor should say, yes, please sit down, relax, because doctor can see the anxiety on the face of the patient, which is also the important factor in the pain. Okay. Now, the doctor should ask the patient, please, hey, my dear friends, tell me where exactly you are getting the pain. Because he is saying that I am having the, he will show you, this is my left side, I am getting here, doctor, related to at the heart place, I am getting the chest pain. Then doctor again can smile, not in front of the patient, but inside he should be happy, because cardiac pain or chest pain related with the heart is more here, retrosternal, that is behind the mid bone of your chest, behind the sternum. Try to understand here, retrosternal, and it is not on the left side. So cardiac pain is retrosternal. Then, of course, very rarely it can be left-sided, but more over the times it is retrosternal and not on the left side. And the chest pain is always constricting. Here, can you see? Constricting, like thumb, constricting. So I asked the patient, hey, my dear friend, tell me, this pain, this is whatever you are getting here on the left side of your chest, is it a pain or is it like a constricting or choking type of sensation? No, doctor, it is really hurting me. It's a pain. And try to understand. So constricting, choking sensation is common in cardiac problem, that is a heart problem. But only pain is most of the time not related with the heart. My next question, the doctor should ask the next question to the patient, whether your pain, left-sided pain, radiate to the arm, left arm, or here on the jaw. That pain you are also getting on the left arm, whether you are also getting the pain over here on the lower jaw. No, doctor, no, only here. No, not at all. So again, it is not radiating to the left arm or the lower jaw. That means it is a non-cardiac chest pain. Okay, my next question, the doctor should ask the next question, that if you walk fast or you climb stairs, does it appear or does it stop quickly when you rest? No, doctor, it is not related with my walking, or pain is not related with my climbing upstairs. No, doctor. But yes, I can tell you one more interesting thing. When I bend forward or when I lift something in my hands, then, oh yes, doctor, my chest wall getting pain. Again, try to understand, exertional pain, exertional dyspnea is a heart related. And that means if it is not related with the exercise, if it is not relieving by resting few minutes, then it is not angina pectoris. It is not heart problem. It is a muscular pain. Okay. So my next question, does it, that your chest pain increase after deep breath or coughing, take a deep breath and tell me, no doctor, I am not getting any pain here. That when that particular patient is saying that after deep breathing there is not increase of pain, then you are relaxed, because it is not related with the pleuritis. Because in the pleuritis there is always a pain after taking a deep breath on one side, unilateral. Lightning pain will be there in the pleuritis. So this is not at all a pleural pain. Now my next question, doctor should ask the next question to the patient of chest pain, whether your pain is increasing when you are swallowing the food. Just let me think. No, not really like that, doctor. No. So that means the pain is not related with the swallowing of the food. That means this rule out the esophagitis, because esophagitis also can give the retrosternal pain, especially during the swallowing. Okay, so our first, what you can say, the exclusion has already been done. So moreover, this is not at all a cardiac pain. Now the doctor should do a quick general examination. What he should do? He should check the eyes, whether there is an icterus, paleness here. Always quick examination. Paleness, anemia. Then sclera is yellow, that is the icterus, jaundice. Okay. Then also check the tongue, baldness of the tongue, indicating the, yes, anemia. Then also check the nails, that means pale nails, and platinikia, flat nails, or coilynikia, concave nails. This is indicating anemic condition. Then also check the feet, whether there is an edema, pedal edema. There is no edema, then it is not related with the heart. Then we have to check the chest, whether there is any scar of herpes zoster, because herpes zoster is a viral infection and there may be post that infection neuralgic pain, post neuralgic pain may be there. Then also little bit doctor should try to slowly, first on the right side, then on the left side, palpation of the chest is very important, and especially over the costochondral junction, okay, for tenderness, because when you touch here, patient will grumble, screaming will be there, because this is a diagnosis of costochondritis. I repeat, chest pain here. Costochondritis is one of the possibility. For that, the doctor should palpate the costochondral junction on both sides, and if they are tender, you are dealing with the patient of costochondritis. Next, palpate the intercostal tenderness. Then doctor should start the auscultation. During the chest respiratory sounds, he can find sometime pleural rub, which indicating the pleuritis because of the tuberculosis, or there may be RAS. Then the doctor also check the cardiovascular examination with the stethoscope. He can rule out the pericardial rub, like pleuritis, pericardial rub or murmur, because murmur and the pericardial rub can indicate the related with the heart problem. So in this patient, it was not there. Come on, go ahead. The doctor should start palpating the abdomen. General examination for the liver, hepatomegaly, spleen, splenomegaly, and epigastric tenderness or ulcer problem. Now the doctor should check the blood pressure. Then also doctor should check the neck movements. Then pain, neck movements means you can ask the patient, bend down, turn down your neck on the right side, central, left side. So these movements, if the patient is getting these neck movements painful, the patient can be a problem having cervical spondylosis, and that cervical spondylosis pain can radiate to the chest. Are you getting? Cervical spondylosis pain can radiate to the chest. So chest pain may be because of the cervical spondylosis. And how you diagnose? During the movement, the patient will get the pain, that is cervical spondylosis. Okay. So in the chest pain complaint, whenever the patient comes to you, what are the important points? Number one, doctor should decide whether chest pain is a cardiac or non-cardiac. Then he should check the blood pressure. Then costochondral tenderness for costochondritis. Then intercostal tenderness. Then of course the auscultation is very important with the stethoscope. Heart sounds, respiratory sounds, inspiration, expiration, RAS, rhonchi, pleural rub, everything. Then tenderness on the upper abdomen, cervical spondylosis. These are the important points to be noted in the case of chest pain. Now, what can be the management? As it for this particular case, everything is looking normal. Pain is not suggestive of angina pectoris, not related with the heart. This is a non-cardiac chest pain. Then naturally, the doctor can give NSAID. Try to understand non-steroidal anti-inflammatory drugs like Voveron, local liniments, Voveron gel, and also fomentation. Sometimes tranquilizers can be given, and if you find that the patient is having fever, lot of cough, like bronchitis, then also antibiotic can be given. If no relief is seen, then it is better to investigate. And simple thing, X-ray test is important, electrocardiogram, then treadmill test, stress test is important, and if required, then general practitioner can refer this case to the MD physician, because if the pain is supposed to be anginal type, then better if you think that pain is because of the angina, slightest possibility, then immediately give the Sorbitrek tablet sublingually, and also the Disprin soluble tablet internally by chance if thrombosis is there as a thrombolytic. Then refer immediately to the physician or the cardiologist. My dear friend, this is all discussion about the chest pain, but in this case, that is a non-cardiac chest pain. If you like this video, please don't forget to subscribe this video, like this video, and then we will see you on the next video. But till then, please subscribe my channel and give the boost for Deshpande's efforts. All the best. Take care and see you soon.